My name is Chung Brewer. I'm a speech-language pathologist, instructor at Western Washington University, and author of the Adult Speech Therapy Workbook. In this video, we will start this process by talking about day one of treatment, getting a referral, and doing a chart review. Let's get started. Let's get into the headspace of getting a new patient. You come into work, log onto your computer system, and see the eval pop up on your screen. Here's where the roadmap or the flow of speech therapy begins. So step one, you receive that referral for an assessment. Your first big job is to figure out, why is this patient being referred to you? Why do they need speech therapy? What happened to them? Why now? What's going on that their physician believes we can help? Time for a chart review. With your eval will likely come a nice pile of paperwork. Not all of it is relevant to us, but we still have to sort through it all to understand how we can help. This is typically the point where, as a new clinician, I would get impatient and want to charge into the patient's room and change lives. That'll come later. We want to make a positive impact on their life, but first you got to do your homework and you got to understand where this particular patient is coming from. So your first pass of the chart review, start with their previous speech therapy notes if applicable or available. When they had speech therapy recently, it's typically simple to figure out why they're being referred to you. You'll likely work on similar goals. So look at their previous goals, skim their speech therapy discharge assessment, and see the progress and the previous speech language pathologist recommendations. Jot down those notes on a piece of blank paper. I like to take a piece of printer paper, fold it in half, and then write down notes on one half for each patient. Now you could switch over from speech therapy notes to the medical notes. These are usually written by the physician, sometimes a head nurse. Review the patient's medical diagnoses. Medical diagnoses that are red flags for speech therapy or anything that's related to the brain, head or neck, or respiratory system. So super common diagnoses are CVA, TBI, pneumonia. Jot down those red flag medical diagnoses on your piece of paper. Then quickly read the history of present illness, imaging results, impressions and assessments, and hospital course and plan. As you read, continue to write down keywords on your paper. Common red flag words are intubation, feeding tube, sepsis, infarction. Even words like swallowing, cognition, and language can pop up and are really juicy when you see those, so write those down. Once again, the whole purpose of this first pass of the chart review is to answer the question, why am I seeing this person? Why are they being referred to speech therapy? What happened to them? Why now? With the notes you jotted down, you could start to get a general idea of what happened. It could be a very general, broad idea, and that's okay. That's all you need right now. It can be as general as they may have a swallowing issue going on. That's great information to have because then you know you need to prepare some PO trials. Another general conclusion you can make is that they might have a communication issue. Also a great conclusion. So you probably need to print out a language assessment soon. But if you want a little bit more info about context about the patient, do a second pass of the chart review. Quickly skimming OT and PT discharge reports can give you information about the patient's physical and cognitive functioning. And you could also look at their notes and medical notes for information about them as a human being. So look at their social history. Try to find tidbits of info about their life, like what was their life like before the accident or illness? What did they do all day? Who did they live with? You could get a lot more juicy information once you actually meet the patient. They could usually tell you themselves what they cared about and what their lives were like beforehand. But the purpose of this pass is to get a very general idea of what happened, what changed, so that you can prepare an assessment to further examine those areas. And when you have a little information about their context and not just their new disabilities, it can help the patient feel more seen, and that can help build rapport. So write down some keywords about social context, social history. Now you can go ahead and start to formulate potential speech therapy diagnoses, including severity. Ask yourself these questions before you print out any assessment. In what area does a patient require speech therapy? Is it a swallowing or a communication thing? What's the number one factor affecting safety or quality of life? So these are really big questions, especially when you're answering for someone who you never actually met, but the chart review can guide you. Look at those medical diagnoses. Look at the keywords sprinkled throughout the notes. Again, ask yourself, is it a swallowing thing or communication thing? Think about swallowing red flag keywords, like any diagnosis that has to do with the brainstem or chewing and swallowing muscles. And a communication thing is really broad. It could include anything from aphasia to motor speech to voice or cognitive communications. You could narrow it down later. No worries if it's very broad right now, but start with that first broad speech therapy potential diagnosis. If your patient has some swallowing red flags, you'll likely start with a swallowing assessment. This is because a swallowing issue can seriously impact and affect safety. So you'll probably have to prepare some PO trials. If your patient has no swallowing red flags whatsoever, then you're probably being referred because they have a communication issue. So bust out a language and cognition assessment. By the way, once you get familiar with reviewing charts, this entire process, from first seeing the eval pop up on the screen to deciding what assessment to give, will take 5 to 10 minutes tops. You'll start gaining confidence in your skills and your decision-making process. But even if you have little experience in this process, your best guess is all you need. You have all the professional education to make the call on what to assess first, so make that call. Once again, especially if you're working in an inpatient setting, it will likely be a swallowing assessment or a language and cognition assessment. The next steps on this flow, this roadmap, would be to prepare the assessment, meet the patient, and then actually do the assessment. But that's for next time. Until then, please check out adultspeechtherapy.co for more advice, including free PDFs and materials for you to download. I'm Chung Brewer. I'll see you next time.